Students tripled in just 1 year.
Yeah, prominent medical groups now across the country are urging the Food and Drug Administration to take action. They want a ban on e-cigarette sales to minors, along with some other things. So how serious an issue is vaping? Dr. Damon Raskin is an internist. He's also an addiction specialist, here to talk to us about vaping, which is taking it by storm, California and everywhere else too.
Yeah.
Is it dangerous?
It is. We're seeing this huge rise in young people, and that's the scary thing. We're seeing 8th grade, 9th grade, 10th grade users because the companies that make this are attracting youth. They're putting flavorings in this stuff, apple pie flavor, bubblegum flavor, cotton candy flavor. So it sounds exciting and attractive, but nicotine, we know, is dangerous for the young brain that hasn't formed. You know, the brain takes a while to form. We don't finish forming our brain until around the age of 26.
Mine's still cooking. Yeah, I'm not even sure we're done.
And we know that long term there are adverse events for chronic nicotine exposure in this brain that's not well formed.
So the FDA proposed, this set of guidelines over a year ago. And by their own admission, they say that they believe that a ban for minors would be a good idea, but they're not doing anything. What's the holdup?
I don't know what the holdup is, but I think it's very important that we get out the word that this is not just for fun, and this is not just super cool. This can actually now be seen as a gateway to possibly increase the risk of cigarette smoking and other future drugs.
We see people who are vaping, they go to and smoke hookahs and
bars.
whatnot, and young people. Seemingly it is benign in the sense that it's a vapor, it's not tobacco, it's not smoke, so you're not actually putting smoke in your system. So, you know, maybe kids are doing it because they think, hey, it doesn't seem as dangerous as smoking.
Right. They don't think it's dangerous. They don't think that there's anything else in there, but we know that that's not true. There are chemicals. There's something called diethylene glycol, which we know is possibly carcinogenic. And the scary thing is it hasn't been around long enough so we don't know the long-term effects. You know how long cigarette smoking was around before we knew how dangerous it was? The same thing with this. We don't know what these other chemicals that are in there will do long-term. Carcinogens, that's the problem. We don't know.
But can we agree it's safer than smoking cigarettes, right?
Well, I think it's better than all of the other carcinogens in a cigarette, yes. But do I think it's safe for young people to use? Absolutely not.
But if someone came to you and said, I don't know how to stop smoking, I've tried everything, a lot of people say that e-cigs work for them to get off tobacco.
So if I have people that say, okay, I'm going to stop using cigarettes and now use the e-cigarette to then help me get off, I say yes, sure,
you say
go
yes.
for it.
Okay.
Absolutely.
Okay.
If they can then actually follow through with that commitment.
Okay, and then I know we were talking about teens here because, you know, they don't think any teen smoking an e-cigarette is a good thing, but for folks that are going to vaping bars and things like that, if they go once in a while, is that okay?
So I don't condone it.
Are you asking for a friend? Or?
Exactly.
Well, we've been, once.
Sure. So I don't condone it. The problem is if you're not a smoker, you can easily get hooked on the nicotine and then you start to use it more and more because you like that feeling, you like that buzz from the nicotine. And we think that nicotine also has cardiovascular and lung complications. And again, those chemicals that we don't know the long-term adverse events. So again, you take your chances.
Right. I knew something was wrong when I had that third eye that was going.
But they're making so much money on e-cigarettes and vaping.
And it's going to be taken over by the big tobacco companies, so you're going to see the same problems that we saw with cigarettes.
Especially if it is that gateway that you're talking about.
Absolutely. And those flavorings that attract kids, that's a danger.
That's where you have a problem.
Absolutely.
Too.
Dr.